it does make it a little bit easier to raise capital because investors know that there is an exit strategy, that big pharmas have to replace their pipeline with new assets, and it's going to come from the scrappy small cap guys that are working on phase 2 and phase 3 products. So have you seen any difference in your most recent capital round? And what is it easier than it was perhaps a year ago?
We have not seen any difference, and certainly it hasn't seemed that it's any easier than it was a year ago. What I would say is there is increased noise, and I think noise precedes action and activity many times. But there is certainly increased noise about the continued building impending patent cliff. And we know what happens is that the huge products end up going off that patent cliff, and the players then typically seek out smaller players who are in clinical development or are hitting registration milestones. So it becomes
Mhm.
incredibly important to continue one's pace, and if anything, figure out how might I be able to accelerate that pace towards some demonstration of success behind a development product. So I think that is, but there is certainly more noise being discussed about that, about the impending huge patent cliffs, the need to replenish that. We've seen this model play out, year after year, decade after decade. It does not go away, and typically, just as you commented on, it's a smaller player that contributes to filling that gap.